Minister May speaking today. Morning, everyone. Today is Tuesday, February 22nd, and we are happy to be back in the chambers for COVID-19 media update. Today, we're going to begin with the Premier offering the numbers as well as a new note about the strategy ahead. Then we'll have Dr. Patterson, our Chief Public Health Officer, providing an update on the COVID-19 situation in the territory. We have Minister Main and Minister Lightstone available for any questions at the moment, and other minister may be joining. Thank you.
Mula sa kullo min nagajawle kay February 22 huwag tugullo mi maligalyo bimutikan na ron naksimigata nagadjano mitsano ukaw sa karakterluta sa wilak tiyo kali malaulo ni katsiulak ninginik amalo nutane pamnaw tiyo sa mayunik luta para sa no kali malangang mayo ang nahat ng itulari yung marik nagadjano 19 nunavo may pilogo at yun na mayo Minister Main amalo Minister Lightstone apesok tayo gumapati.
Kuyan namin si Mama Ule. Udra ko tiapa ka Nunavut mo tayo pidong wato may nakulufu. Udra nalatun. Udra ngayon nalunay nasibo ko 310 ngayon nuwan na zuwalin. Udra tako 21 ngulot nunalivo at tuklaw si mayon. Avito si maning emailing avon. 1 ipiadzumen 4 akvean 5 kamanitwa 3 ikalututia 0 iduligadyo 2 kangituwape 4 sadl 25 iglulik 85 ikaluin 10 uksuktung 0 kimmeron 4 kinge 26 kuwadyo 1 kubluktung 8 nauyan 19 panotong 24 Mitimatale 3 Likitadzua 40 Rankin and then Kangitlina Mamana 4 Kauswitong 18 Sanaraya 3 Sanikilua 21 Talotzuak Ama 0 Tikiradzwanen Katidliwitakwa 2,230 Ulupto Nuvanadzua Karumnosimayatana Nuvanadzua Tavunga Nunavumun Isilausumatidirum Tan 2020 min pigiaro tigi dausi magatigo nuvan nadzua takwa parnau tigi vadlearat tasimadlutigo kano tamanna Nunavut iliwano sayma hunatigo asuwa yautua semen namman takwa akagwe makko atoksimalotutigo takwa nalunay khatay nasimagatigo nasa padlearat tasimayavo nuvan nadzua nunalenu isapadlea simayunja tunga vekhatluka tuwaro tukhatluka nuvan nadzua harunne romanita Nunavut iliwanem. Udlumi uluktaw, taana nutamo tuwara kumnapugun. Taana kawimalagatam, atukatasimadlutigudlo, nuvan nadzua tavunga, Nunavut mo, isasimalotlamne, kawimatiagat tatakwa, luta padusan tekatatengin, asinsopadliagat tasimaninga, taana nuvan nadzua, adjigingittamne, takukatasimalagatam. Idigo te khadzwa simagivugun takwa kano Nunavut me taun ila Nunavut me kigatu idioka kano nikago sutluta pidori vadea tasime nagatta takwa nunalevo pidjuti gidiogum kawi makata ugivugun takwa attanatede matitigo tigadzwa simajavu tu tigidogin kapokta utigi khatasima tunga vigidagattigo mannawyum udlumi montikitlugo Asual kuyan na may rumavunga, luta Patterson, ulugan at may kumnatigon, atulak ko yangin, malin na tiyasi magatigon, udlumi mo tikit sigo. Takwa pinaswa ko sin ang matakin, sibunitin tukapad lialot tavon, tana, tunga vigin na tiyadlo tigon, luta Patterson, atulak ko katasiman yatangin, Nunavut men, pag napadliaga akong nayakata, takwa utu tigilo tigo, idi ko tigilo tigon, kanatamen ako to kapadlea si mayon amatako sango begin nam napabuluta Patterson nutamo to kapadlea natilota kano tana nuwan no zwata vaniti jego inusap po kayo sigum nakulutigum kayo mako yityapunga pang nasimatiang nagatatako nuwan no zwa pidjutigi nunavumilta kuloy isumagin natyadlepigum Kayo magatatakwa nuwan no zuale ila nuwan no zua tavolo tilego parnau tiki kumasiman yatavo kanatame asingin utu tiki kunangin yatigo utu tiki lego Toronto uvalone Vancouver tavunga ikhalonen uvalone tiki qarzuamon utu tiki kunangin matam ipikit yado tiko tana parnau tiki kumanapavo nuwan no zua pidju tiki lego kisiane malin nagagatiko tako atulako yausimayo luta Patterson tako luwa natume kung natiko ijakuluhun amma nuna levon piduang watume inapon amma tako nutakakuruin kapokta kung nasimangikay nasimayo manamo manna yo tana kaiti tigakan na kumabunga nuna bumiutan tako kinang matwasimay na kung nakudluse kapokta kung naton kapokta katadlupen matako ang ikasima kung nakose ang ikasima katadlusen matako amisi uluang ito kata kung nako yaw si ngini si malay na kayo nadlutikon so tabong kayo na pujan namin udakon special greeting to Nunavut that are listening, especially the elders that are watching this morning. As of this morning, Nunavut has 310 positive cases of COVID-19. We have active cases in 21 communities. The reported numbers are 1 in Arctic Bay, 4 in Arvin, 5 in Baker Lake, 3 in Cambridge Bay, 0 in Chesterfield Inlet, 2 in Clyde River, 4 in Coral Harbor, 25 in Igloo Lake, 85 in Iqaluit, 10 in Joe Haven, 0 in Kimmeron, 4 in Kingain, 26 in Kugadzu, 1 in Khullukto, 8 in Nauyat, 19 in Panukto, 24 in Pond Inlet, 3 in Qikatadzua, 40 in Rankin Inlet, 4 in Resolute Bay, 18 in Sanarayak, 3 in Sanikilua, 21 in Talotzuak, and 0 in Whale Cove. There have been 2,230 total reported recoveries in this outbreak. Since 2020, our strategy in dealing with the pandemic has been to keep our territory COVID-free. For the past 2 years, we have shared case count numbers for each community in the hopes of one day returning to 0 cases. Today, we need a new approach. We now know a great deal more about COVID-19 and the way the virus mutates into different strains. We are also learning important lessons on what works in managing the impacts of COVID-19 in our communities. Furthermore, we are armed with important tools such as the COVID-19 vaccine, which I encourage everyone to go and take. Today, Dr. Patterson's sound advice has helped us to keep our communities as protected as possible from the risks of this pandemic. In the next few weeks and months, with Dr. Patterson's guidance, Nunavut will be following the lead of other jurisdictions across Canada and around the world. And we will now look to him again for guidance on a roadmap for how to live with COVID-19. Rest assured that any plan put in place will be designed with the specific needs of our territory. We know that solutions that may work for some urban centers such as Toronto and Vancouver may not always be appropriate for Iqaluit or Whale Cove. While our approach to COVID-19 may change, continuing to adhere to the public health measures will continue to help keep our families and our communities safe, including vulnerable individuals such as elders and children too young to get vaccinated. In the interim, please continue to do your part, wear a mask, get vaccinated, and get your booster shot. Please stay home when possible and stick to your small bubbles. Kuyan namin. Stop.
Good morning. As of Sunday, there have been 23 Nunavut hospitalized since this current wave of COVID-19 infection started. Last week, whole genome sequencing revealed that for the first time, one person in Iqaluit had been infected with the BA2 strain of COVID-19 infection. There is no evidence that it has started spreading. And although this strain spreads more easily than Omicron, it does not appear to be any more likely to cause serious infection than Omicron.
Ulasakut, Natsingoya Lotumi, 23 Nusimalatu, Nunavut mute, Unitsimayut, and Nabimitaman, the Selma Palianak, Nova Jonak 19, Pigalawani. Pinasausilo to me, Tamako, Naluna, Rutiu, how is a Rutico, Naluna, Teolo, to Civil Mitaman, Ehaluni, Nova Jonak, Simayo Halekto, BA2, Nova Jonak 19, Tarotimi. How you not to have Simang to Taman, Stan Nasija Palayo, Selma Palia Simamanga, Tan Selma Palia, Gunam Nesta Marito, Omicron, make Kisani, Dayma China, Kanim Magutalo, Najang to Omicron Tito.
Sorry. Measures in Arctic Bay, Pangertung, Iqaluit, Rankin Inlet, Coral Harbor, Senekilowak, Cambridge Bay, Kugaruk, Resolute, and Pond Inlet will be eased to allow for larger gatherings and more visitors in homes. Restaurants and licensed businesses will be allowed to open to reduced capacity, and indoor team sports can resume. These changes are as of Monday, February 28th, and will include the following key points. Outdoor gatherings increase to 50 people. Indoor gatherings increase to 10 people plus household members. Restaurants and licensed facilities may open at 25 people capacity or 25%, whichever is less. No singing or dancing will be permitted. Public indoor gatherings increase increase to 25 people or 50% capacity, whichever is less. Gym capacity will be 25 people or 50% capacity, whichever is less. Libraries, museums, galleries, their capacity will increase to 25 people or 50% capacity, whichever is less. Arena capacity may increase to 50 people or 50% capacity, whichever is less, as well as a maximum of 50 spectators, and team sports are allowed. Places of worship are limited to 50 people or 25% capacity, but no singing permitted. And long-term care facilities may allow 2 visitors per resident from their immediate family.
Iperdumi, Panatumi, Iqaluni, Kansinami, Salami, Sanikilami, Iqalututami, Kuadumi, Hausuitumi, Mitsimatalimbilo, Hasuya Gerner, Amisuna, Sekatata, Nalas, Hulugamalo, Pulara, Takata, Nalas, Hulugi. Nerivit, Imerbilu license, Hatu, Matero, Nala, to Hatsina, Harlotik. Amalotako pingwa bilo ani pingwa katigi pingwa kan khataw na la sejut tamako asa jirota yu nagajal February 28 pigalo ne kwangu nato sila me kate khataw na lotik 50 gun natun ilo ani kate khataw na lotik khuli gun na lotik ang qariya yu ne khakan ningagot ang qamiuta ya khatsiu ningita Nerivit, Imerbilo license harto material na to 25 nilo ino haron na lotik balone 25% in a letter in Nakatsi now nasa. Ingi hataya hadjangit to tanis hataya hadjangit sotillo. Ilo ani katekata na la tamisong na to 25 gugun na lotik balo 50% ino haron na ningita na letter in Nakatsi now nasa malitawloni. Ikhaili sabi mino haram na lato 25 ngugum na lotik upalo 50% tingita ino haram na ningita na lato ina katsin na ninga malitaw luni. Ino tulo tikisani ikhaili sa hatal lotik. Ukhali mga gahabin, takuya gahabin, Tako 25 na ino harun na lasa bulo 50% tinga tayo harun nang nangita na liato in nakatsin na sa malit taulo ni. Tako katinga yun na ita ma no good tours. Katinga yun ita ko yung gakti tau gaya hakto kadyang ito. Tako anik ito bime ino harun na lasa yun 50 kung nakluti ko balo 50% tinga ita ino harun nang nangita na liato in nakatsin na sa malit taulo ni. Ang malo 50 kung nakluti ita kung nakaroon naton. Tako iligi pingwati pigaron na lasi tako tutsabi ino harum na lotik 50 gun na lotik balo 25% ingata ino harum na ningita kisa ningirum na jang ito sule tako ino to hak covid pula ata gun na lasi makton ni pula ata harum na lotik tako ilagi jangin ni.
These measures align with what is in place in Avit, Baker Lake, Chesterfield Inlet, Clyde River, Joe Haven, Grease Fjord, Kimmeroot, Kingite, Kugluktuk, Nauyat, Pond Inlet, Kikiktajuak, Sanariak, and Whale Cove. There's no changes to public health measures in Aglulik or Taloyuak. Please remember, masks remain mandatory in public spaces. Getting vaccinated and boosted as soon as you are eligible, as well as wearing a mask, are our best methods of protection against severe infection. Thank you.
Tako malitaw gali nalimagi ko ti khang na lop to taman na ila talegyak to ni tamani to vani avani kamanito ami igluligar jumme kanyak to gapimi usuk to mi ausu to mi kimmeromi kingamni khulok to mi nawyani itsimatalimmi kikiptarjuami sanirayami tikirarjuami lo asap jitaw jang itu tako ki ana hamnang ituloy na mamalittaw gali iglulikmi talokjuami lo iqamana yaqusi suliasa gorbekang itu kumatawasmay na hattara hagatsi namilima kikkulimano pattaw gayutunik kapiyaw kuyaw busi amalupingayoan ni kapiyaw kuyaw lusi khilamiyo na pakon Mato si mahatalo si tayo mata ko sa pumiyaw siya gutiyo na pangagod ng ata kanin malaki guti kakunan mo. Yan na may.
Trevor Wright, Nunavut News. With the recent changes to isolating basically in the home community, is there an increased risk to household transmission with hubs being scaled back?
Trevor Wright, Nunavut News. Kung nasa joktaw lang tilugitay ko, anitay titaw kayo nakatali. Ang ikangamin ni tikipalya yung anitay gaya kalap tilugita manolo ka anak tumigo tao ba ilumiyo kataw yutak ko siya makbiuto yung nakahamning.
When the changes come into effect, there will be a slight increase in frequency of introductions, but it's a fraction of what there is compared to travel between communities and other risks that are already part of what's happening at the moment.
Tako asi jiro tayo atulik kata tako nalunang ito misungura kan ni kay nalatun siya magbiyo katatun. Tako kisa na hatsin na sawayak to tamakko awla katam ni yununalin no takulugit asingin no luman na yuluga anak to mito tayo matchay na tuwi na anak to eh.
That was part of the factor in the recommendation to the change. The other part was the fact that at the end of February, everybody 5 and up will have had the opportunity to get vaccinated at least twice with a couple of weeks for the doses, the protection to kick in. And it's a very small number of people that are needing to isolate at the hubs these days. So the overall impact is going to be quite small.
Taman na ilagi yaw law to sidjak taw balla tilugo sumasasiyo taw tilugo February lunungwa ni tamakko 5 ni ukiuli tako pipikakti taw yun na sumalang tamakko ati kapiyaw gunna ng tamakko alo atulak palla tilugo sa pugmiyaw gutinga kaputik ko atulak palla gunna sila ngata at tuwi ni kalwa jang itu taman na amalohat sinaw naksay tako kinuniago anit tayo likat tayo harong naksila si matakat sinaw nakpa.
The Premier mentioned next few weeks and months new strategy in line with the, I guess, more with the South, I guess. So what does that strategy look like, I suppose?
Sibulat yung hakaw mapinasa ako sigalaw na ato ni takigalaw na ato nilo tako malitaw gali nalimugili palya lang at asulo kanu na nitito kanutan na kanok tukutiu sa mayopak nauti takot sa ila.
It's going to be a gradual change where every few weeks we ease a certain area of measures, and it starts with the change in the isolation requirements, and moving toward the goal will be moving to our management of COVID-19 towards something that's much more much closer to how we manage other viral infections like influenza. I'll let everybody interpret that part. Carry on.
Taman nasid sa palya ko tawla to khil ataw sikko along ito ako asid sa taw ka sa katalo ti solo bigya ko ta hallo ti anit teli giya ka ni titsilo ti tamak kuning atiki palya ni aktonik to kaga ham na ang tatawlat sinang minubad jo anak 19 mi tay ma chay na solo akay ko tama kanim magutaw su tay ma ti tawla taw palya nga na lang.
So we'll be looking at ways of stepping away from mandatory isolation for those who've been exposed, are moving away from limiting gathering sizes and other measures like that, while at the same time maintaining adequate testing and surveillance so we can respond to outbreaks that are focused around high-risk settings like elder centers and schools, and maintaining that, moving towards that approach.
Hawi ka so na katatamak ko atuti ila anit teliga hauni titsi sagum ne katatamak ko ninga katiyaw si matu naktunik tako ila sulit tabi hakti taw khatta ne palle lo bi khatsi katigun nam ningit hawi sanga no sautu na khatta lo ta watsit sa lo ta lo tamak ko so lo sa mabi wala lang ikalo mga tapilo ato mi khanim magum nak naksaw yusul lo inaw naksay ilina binilo ni taman na pili reduce sa ngam na laktabu hawi sa palle khatam na.
Teresa Khachuk, CBC News. Khachikak si malaka tako pigalaw mani inuto kuvio gakto khatak to hallo nani man namuno khachikak si malaka Nunavut government ngano. How much has the GN spent on southern isolation hubs to date?
Perigavi ublacha man na time na how apek khoti ya pihimangitaka iheni pilagay nu kawigi law lunga kiu duty coming I don't have that specific figure in terms of the cumulative cost of the isolation hubs, but I'll pull that from my staff and provide it to you if that's acceptable. What now?
I don't know if you'll be able to answer this one either. It might be for the Premier. Canadian North Gunno. How much has the GN spent on supporting the airlines to date?
Yeah, kaya nami Suisa ta na pa kotitia valo. Kaya ma yun ako kata ta na nuwan no juang. Kisuluma mi atu si mamman. Tako government tabani lang nga walwa solitan na nasa utinga pisimangin na kuman na yo. Kisan kaya makutya te ko tako timmisio umagutiki gattigo kadonate to it's a lifeline adjiging imbago kanata mete mauni kakawata adjigi tuinatya maguta makwa tako timmisio nunalitinnon iluang waktu me anya villarreal kayusin na kaya kasung mata tabung malaw na nga solita ko ilisa ka jaw si madlote ikayok taw kaya kamnengin ipigi jaw si mamata Nunavut government nun amma government to kakun tako ikayok taw si mayon Te matau nasa utinga ilikulunga pisimangin nako kanusanangi koven utokrigi kumnarnearapin ikayokutigi jawatassimayon udlumimut tikitlugu kisian kaujimatluta sivunimo taana qimiqquinnarattigun ikayukkannereaqarutta ikayuinnaqasunneaqatta uluqiannaqunnarigi nunavumiute piluanguartumi aanniaviliarealikuluin nunavumiutan kayusiinnareaqarmata taana pileratiginnattiarnaappagun taana pijutigiljutigun. Thank you, Teresa, for the very good question. I believe we all understand the importance and the lifeline the airlines provide our communities, with all our communities being remote. That's our highway. And in the past, prior to my role here, there has been supports provided to airlines. It was critical and essential for us to provide the support to allow, especially Nunavut who require medical attention. And as such, we prioritize our ability to be able to provide support to that critical lifeline. And so I don't have the specific number in front of me right now, but I will commit as well to providing you the supports that's been provided to airlines to date after the conference here. Thank you.
Hi, my question is for Dr. Patterson. Melanie Rochat, Nunatsiaq News. With restrictions easing gradually over the next few weeks and months, when can Nunavut expect kind of to get back to normal, and what will that normal look like? Are you thinking of eventually taking away like the mask mandate and things like that other jurisdictions have done?
Dr. Patterson, taana Melanie Rochat, pinasa ako sigalaw na ato Nunavut message sa palle na lang atate maino sigakatay at tinutik palle lutik kano taman takot sa wala mga solo matwak si magyaham ni tamak ko mitsano nalo na rekan nalo.
Yeah, a lot of it depends on what happens with case counts over the next few weeks, and the evidence is pretty good that a gradual stepwise approach is in the long run safer, especially given our circumstances. So putting an exact date on, by this time the mask mandate will be lifted is not appropriate. It's more dependent upon similar to how we did in the spring and summer of 2020 of every couple of weeks reassessing and taking another step.
Tako adyo hatta jangi tu tako no badyo na ta sa mayo khatsyo ning imalit tu pinasa ako sigalaw na ato ni tako sa khapalle sa mayo khawi sa mayabu tu sa ko minaktu galawat kasi nata utsikko alo tako asijir taw jangi mata uluga na to mi teire titsi khudilota pilo apto mi ullo mi mata na ullunga ne kharon na jangi nata hanga solo ta makko no khapita gayang mga tamato aksi makatari hamni. Tayo maupanganga ni yang ali 2020 pinasa ako sinaga mata khatsigalay asijir taw balle ka jo hatta yung mata tayo matchay na tayo may lang ayo.
Thank you. And I think it was last week we heard about the drug Paxlovid to treat COVID arriving and being distributed in the territory. Do you have an update on approximately how many people have been prescribed that drug and how people are responding to it in general?
What's the drug called?
Paxlovid. P-A-X-L.
Tanago Paxlovid. Iyaga tikihat pila. Tama na ito na ulang ukara akong nakikat si tatsumi nga iyaga simalang mga ta.
I don't know exactly how many people have had it. I think it's available in all communities now. I think it was first used more than 3 weeks ago now. And the people have been have responded well to it.
Kaya mga ito kat sila kita ko iyaga simalang mga ta tatsumi nga kasi ani nunalilimani nuna bumato na ulit to siguro pa mi pinasa ako si pingaso tana atuin na ko laos mayo.
Desservi Radio Canada. We know that the BA2 subvariant is more infectious than the Omicron variant. Are you expecting the BA2 subvariant to impact differently policy and measures than the other variants?
Mati sabi radio Canada kunita nagu BA2 tikit simalanga tambalo sa mamna saugong naso ni Omicron mi kano taman natu ina haptigila katama kuninga malitaw gali nato agaw titaw yuni.
It depends a lot on what happens, and we continue to do whole genome sequencing to identify the variants that are in territory, but pauses or changes in our approach in terms of easing measures, that's dependent entirely on case numbers, not necessarily the strain of COVID-19 infection.
Tanay lagi hatta jangin biyo taman na solo how isak tau gak tugal lahat tam na ngata sulit tamakwa how isak bilakin not nalang ang mga tinova jonak tako tau hatta tinuna rumme kisa ni taman na si jiro tau hatta nga hasuyaw gak hatta ngin numalit tau gali tamatu mga pidyo te kajang ito kisa na hatsiulam ngin nunova jonak ta simayo tamakwa tunga bigi nga hatta na tabo takwa nova jonak jiging ito pidyo tau jang ito.
One correction. I should have said it's more dependent on the load on the healthcare system and the impact that the overall on an individual community, not so much the case numbers.
Kaya naliutan na sulo na hamnang ituloy ng mopilig jusyo yo may galwalang nakatatan na pimario ng pango yo tan na tatigin na pa hatak tabasid sinali kay got tamak kuning malitaw galin ni takwa hatsyo ni picture hangin sa luta.
The Exarnet Hotel in Iqaluit is being turned into an isolation hub for medical travelers who test positive. Can you tell us if that's the only in-territory hub, and also why you're still keeping the southern hubs running, some of the southern hubs running for medical travelers?
I didn't get some of that, but I'll try. Tayo nakuha ni tuyong mivik ani daily view kay nakatam na lang na bila sa mayo na nubad dyan naktakto minyo yun utan na nuna bumitan na tunya ka magbalo suli lang ikalunani tayo may katarang ba.
So by federal law and territorial order, you cannot fly if you're still considered infectious with due to COVID-19. And so people who come to Iqaluit and are diagnosed with COVID-19, or people who are who are in the south and test positive, say at the airport, they will not be able to board a plane until they're cleared from being infectious.
Kapamatukat ko no maligaw tamani luno na bumi maligaw luni kinatuin na siyang maggunak to kani maguti halo ni hangatagya hangit sa to no badyo anak 19 ni solo kalunok to hamna kanwa badyo anak 19 ni kubalo ni kaluna ni kawiyaw yo hangatayo ko minu badyo anak to limita ko ikititaw gayang ito hangatayo mo.
So for medical travelers, we have an obligation to provide them with safe space to isolate until they're able to travel home. And so in some communities in the south, we will need to have facilities to do that, and we also need the facility here in Iqaluit.
Ako ana bila simalutiaw lahat tagali di ma pipit lapit siraw jaw giya kangata tanak tumitay le khullugi ta ko ani tayli ga hatillugi pilawang wato nuna liminong kami no kilawin ngin ilang yakaluna ni tay may khatam na tut sa buwan bali ilang itamane khalumni.
Trevor Wright, Nunavut News. Would it be possible to get an update on the COVID situation in elders facilities and, if possible, jails?
Trevor Wright, Nunavut News kunni tusapit siya na kasi na COVID ni nuwa jo anak ta si mayo ni balo amalo anong lat 7 ni.
Perigabi Trevor, inutukaw hivi mikano kiuyu luak tunga kiheni tugu yau hima bi mikano na hau takangin na ma no yo ikuluk. Te mata ko inutokau hivi nunavu iluani he otutal limat tautuk lugin. Man katiluk ta lugin nubang na ulakang na tau 12 nguyun. Pilirejid lu inutokai katilugit. Ta ko tal limau mat inutokau hivi katiluk ta lugin na hau tingin 12 nguyu galuit. Okaktu luak tunga kihiani kanuing itcha ko yun ang mut nutokau hivi mi kanu pilarin na yakapta tap ko hanate le ako hitamat pilari gi jaw yut amma inutokai kawi hakta utang ningit samanna huli atong na kaptigo kablo natin to surveillance testing nubang na lik takang ningit mga kawi hakta yang na kaptigo kanuing itcha ko gapta. Right now, Trevor, I can speak to the elders facilities. I cannot speak to the correctional facilities. I do not have those numbers in front of me. So looking at the 5 elders facilities in territory, between those 5 facilities, there's a total of 12 positive staff and elders. I'm not going to break down that number any further, but I can say that we continue surveillance testing once a week. There's intervals for surveillance testing in terms of the facilities because we are, as Dr. Patterson mentioned, we've placed these facilities as a priority in terms of making sure that the residents and the staff are safe. And so we plan to continue that surveillance testing at 1-week intervals for the time being in terms of managing any potential cases, whatnot.
Oh yeah, you said it already. Okay. This next one's for probably Dr. Patterson. Is there any up until recently? I guess the numbers in Iqaluit have been fluctuating up. Is there any particular reasons why? Like, is it gatherings? Is it household spread or?
Mana mango si mayuta ko halon niya si jokta nang kata sutillo kat si uningita ko kisumi pidjuta ka so ibig katiyo kakatanga balokano.
There's a few reasons for that. One of them there's a lot more travel from the south, and so up until I think a week or 2 ago, and maybe this trend has continued, Iqaluit had more outbreaks or more introductions than most of the rest of the territory combined.
Tako diging ito ni pidjutili ilagi jaw yung tako ami so nagsa kalunani tiki katalang ngata pinasa ko si ulok tumimakulo ni na ikalun ni tama nga tikito no kisani nubadyo anak tabiyo katalaw nga tayo mga pinagpangulo ni nunavumi siyang manginik ko kisani tikid biyonik ko.
In addition, there's fairly common for people to come here on medical travel and be diagnosed here and then captured in the numbers for Iqaluit, even though they may have been exposed outside of Iqaluit, within the territory, but outside of Iqaluit. And so those skew the numbers to cause Iqaluit's numbers to be higher, proportionately higher than any other community.
Kaninga gulo tako tama tiki katat di pilo ato mi anna bila suti nuna lininga ato tako nuna nga nisang magbiyut sa nakalo suti tama nga ay matakaw iya hatang at ano ba jo anak tuloy tama ni nakituin na sa mayo tayo may matakaw kat siyo ning ikalui ami so nagpango yok jo ja hatak tu ilangi nuna lininga sa mayo miniw galo aktilong.
Teresa Ketchuk, CBC News. Una kaisi volek timo kiusa gunnakto. Tukisigi akan ni kamatuin nakto nga tako illo kangito yan kakangito ilo ni namo inutugi akto sa mga ti novakjok na taknak pata. I just wanted to understand a little bit more what are the resources or where do what happens when someone who is homeless catches COVID-19? Where can they go isolate?
Yeah, ko yan nami nallinaqattallapun illukissarnertaana angiyume saqqisimartuarma piluanguartumi taana nuvannertua nunavumuulorsumatillugu taana oqarunnartunga assuruarutikirtuaqattigu qanu illukissarne attuisimamma angiyumen taana apeqqutittiavain iluane kingunittinni ikajoqattarsimajavuuttuutikillugu tavvanittiun uluguanartuminniarnerute tuyormivimmuuqtauqattarsimayun maanna naasautingi pisimannagit qasiulummangaata kisiani atuqattarsimajavu tamanna uluguanarnerpaamittun ikajoqattainnarsimagattigun taannalu ikajuinnarniarlutigu sivunittinnu parnappadiarniartilluta. Thank you so much for the question. I think we all understand the impact the lack of housing we have in the territory has really put a spotlight in terms of the vulnerability that we see right across the territory, and that's something that we've taken not lightly whatsoever. With that in mind, we've really helped the vulnerable. I think with the homelessness that we've seen, and I'll just use the example here in terms of us providing accommodations in a hotel. I don't have the specific numbers, but we'll continue to assist and look at every situation uniquely and provide support where we can. And I know we've done that in the past, and I believe Dr. Patterson's indicated that before with the support of family services specifically. So we'll continue to monitor that situation.
Summa Nunavut government me kanaisak dilimangi kapisaw simagya tungim mata ilong nate. Sorry. Can you why hasn't the GN made a vaccine mandate for all GN workers?
Yeah, kuya nami Teresa tana apakote tiaval tana Minister Mutuningalnearaku apakote piliriaratiamago. Thank you so much for the question. I'll pass that question, very important question, to the Minister who's in attendance right now.
Good morning. Thank you for the question, Teresa. This is a very good and important question. This has been asked on multiple occasions throughout the duration of this pandemic. And I have recently had responded to this question posed by one of your colleagues at one of our previous COVID pressers. To date, Cabinet has yet to discuss a vaccine mandate. Again, our government is merely 3 months old. However, as Minister of Human Resources and Minister responsible for the Public Service Act, I have initiated the process to begin these discussions. However, the policy development process is rigorous. And for a significant issue such as this, it is imperative to follow the process to allow for thorough review and ample consideration. Yeah, sorry.
Kuya nami apertura bitats mga pimario yumekta nago kiwatala umiyakalo ang atakwa stulego minister khatigi suleo khatigi gutahakale kapiyaw sa mga kalarit to hamna mga takwa gavamaulitay nang watatak hinipingasunik tanalo minister lunik kanayak tuloy kuno tamatsuminga pigyak sistema yu gavamakunik kanayak tingin no pikuyanganik tamko hausi wala hulit tugit takwa lo atawagaling ng muwakit swini takwa tangyak siya kalaking mata tamakuning ay sumasaksi ako takat siya simat luti maligya kalaking mata khimiko katang lutilo.
Thank you. So as I previously mentioned, this item has yet to come to Cabinet for discussion. However, it is now on the agenda, and we will be having this discussion soon. And once we do, then we will be informing the public. Thank you.
Yung kakamay la sulitan na minister katigi katimayingin no lang yung masulikis na ni mana katimat jituisang iniling ata naman nakalo hausiula siyo tusakti taula tusi.
Tukisi si magamaman na tamak si magama okaw ti gon naktanga anya hak nang itulirin mo kanay zakti kapisaw giakak mata kiko kya ngay tachumi ngay sa malio hatak kakano. Okay, from my understanding, correct me if I'm wrong, I know that the health department, they require to be vaccinated. How does the process happen? Like, who makes the decision who gets to be vaccinated and who doesn't?
Matna Teresa Perigabit Matuminga. At natin si ko bluta kapiyaw himagyakan ng mik atulak ti himayugut kihiyani okaktu luaktu maka adjungin nibut abik tok himaniyo yut kabumaw iluan itaw tuksugi adjungin nibut pidjuti gitsugu hibudliyo himagapta tabbo na ila kihip tamana atulak ti himagapta pekoyak takanik mat kapiyaw himagyakan na umik kanu kaputit ahingit ihumagiblugit nuwang nawrakang mo anelay ko tayo kaputit ahingit vaccines mikano pitakani laok man taman na tayo mapidyo tigit sugo ayok nangin na kaulak rubat tino at na tayo dito si kubluta at tulak dito si yakeka tamat tuminga. Thanks for the question. So in terms of the Department of Health and our vaccine mandate, we are a bit of a different case when you look at the different departments within the GN. We're in a bit of a, I guess I'd say, a special situation in terms of the vaccine mandate. Our staff are on the very front lines of dealing with COVID, and so kind of a higher level priority as I see it. And there are also existing vaccination requirements for health staff for other vaccines besides the COVID vaccine that made it easier for us to implement a vaccine mandate for our staff. So we were both a priority, as I see it, within the government due to the nature of our work, and it was also easier for us as a department to implement it. Because of the nature of our work and the existing conditions on our staff. So, thank you.
Dan atchuro tigigachu kapisaw si manik ikhanay zakti lima kapisaw si mazok juza kaya kakazakto kikutuin na Nunavut may malit husin niroche. Yeah, so you and the Premier, you advocate for people across Nunavut to be vaccinated. I guess I want to know why all departments can't be vaccinated. It just doesn't make sense to me. I guess this question would be for Lightstone. Mm-hmm. Why is it so hard to get everyone vaccinated in the GN?
Okay. What? No.
Thanks again, Teresa, for your follow-up question. As I previously mentioned, significant matters such as this, a vaccine mandate which requires all employees to receive multiple doses of one of the approved vaccines is not a decision that can be made lightly. There are many, we have to ensure that we are balancing the rights of our employees with the needs of our public service, and more specifically, those that we provide services to. Other jurisdictions have implemented vaccine mandates, and there have been many pros as well as cons to those mandates. But we I just want to reassure you that we are considering this, but it's not something that we can make a decision on lightly. Thank you.
Yan na may aperikan na gabi tamako pimario yo tema ya apekuti yo sule kana yakti kapiyaw si magyaham mga ta kapiyaw si magyahalik tin na utigo kapiyaw hatta hasiga yang atangir taw si mayuno kaputi no tan pimario ti taw lo nei sa maliro taw ga ham na ang tamako lo piyon na utingi kikutu nei tamalo tamako kana yakti butamalo Spirit sirak patang ita makoasi at siging ito sa masakseo ti harattigo. Asingin nila ito si maniho yun ay kanatamita ko kapiyaw ga haktit sila tilugi akaw na ako ti hasuni akaw ngiliyo ko takahatak si mayo kapiyaw ga kalaki gusingit. Kasi aninalo na tigigon na tagi taman na isa masakseo ti siyangat. Kaya makapiyaw ga kalaki tit sinamangata.
Melanie Rashad, Nunatsiak News. My question is for Minister Gross. Do you know how many classes in schools? Oh yes. Do you know how many classes in schools have been canceled on average over the last few weeks because of teacher shortages and a lot of teachers isolating? I believe the rule is they have to isolate when they have one symptom. And I believe in a lot of communities there aren't enough substitute teachers to take those places. So yeah, I'm wondering about the number of classes canceled.
For the question regarding staff isolation. That's a number that I can't fully say, but I can give the percentages. So right now, we have staff that are isolating are in the Kikikdani 4.9%. In the Kivaluk, we have 6%. And in the Kitilmute, we have 8.4%, with a total average of 6.4% staff isolating. And as we know, last week was PD week in most communities, so we'll see those numbers hopefully shift this week. Kwana.
Kuya na may aperiga bita ko yung kanayap ti aniteliga hamning no pidyuti hasuti hatsi ulata mga tao harum nang ikaluak tanga kisa ni percentingin niyo harum nak tanga ta ko yung kanayap ti aniteliga hasi mayon 4.9% kikirtani 6% kivalami 8.4% kitilmuni katilugi 6.4% kanayap ti ta ko ano na bumi aniteliga hakti tao sa mayo Pinasa ako si Ulaw tumitaw no na bumita ko ilid na atit siya ilid na alaw nga ilid na atit siya ilid na atin nagit so tako hatsiyo nang itabani pinasa ako sa message siya pala ito nakali.
Sorry, can you clarify what those percentages are referencing? Is that kind of 6.4% on average on any given day, or is that a certain time frame?
Tako percenting kiso mo pidyo ta mga tanalo na yakan ni kay naki.
That was for staff isolating as of February 11th. 11th.
February 11 mo no tako tag kanayap ti aniteliga haksimayo ang kaksimagali.
Okay, sorry, is that 6.4% of staff total have isolated since February 11th, or is that a daily percentage kind of on average since that date?
Hold on. Sana ila 6.4% kanayak ti kano uluta mata ganite khatangin ningin nalo na siguti.
That was the percentage of staff isolating at that time on February 11th, 6.4% of the total staff, which is 835.5 staff, 6.4% were isolating.
Thank you.
Representing kanayak ti February 11 ngutilogu 6.4 taganit ti liga kalaos mayo ta kunangat 835.5 kanayak tingin ni.
Thank you. I just have one more for you here. A couple of weeks ago, parents heard you kind of encourage every child to go to school. But I've been hearing from some parents who want to send their kids to school, but they can't because a lot of those classes are canceled. And some of them are reporting not getting learning packages at home. Aside from telling parents to kind of redirect their concerns to teachers, what can you tell parents who are worried that their kids will fall behind?
Takuangila hojo tayo matailid na kan parle hatta kuya ula sutik takwalo tu sakhat semalu nilang yang yok haya ilin na reaktit sakhat tangin mata takwalo ilin na tinagi takwa ilin na utis sangin nang kamngin nipit tunayaw hatangin mata kanok lang yok haya no haya yakhe.
Juana, for the question. We all value how important school is, and we encourage our students to go to school when possible if they're not isolating or they don't have any symptoms. And as mentioned before, some of our communities have different percentages, either 50% capacity or 100%, and most are at 100% across the territory right now. And we've heard great examples across our schools where the schools are being innovative and resourceful to ensure that learning continues and when the students aren't in school.
Ilang nila suli no nalin ni 50% na ni matur si mamata ilang 100% may galo suti kisa na may sunak pa 100% nga ni matur si malaktu galo tamani no na bumilin na be ta na to sa khatta si mayo to sa uminak to ni ta ko sana to ni khat siya to ti khanok ilin na aktin na ilin na aktin si balle khatta ko nak si mamangata.
So we have teachers and staff that are hand delivering up the learning packages in some communities. We also have in Igloolik, the high school has used the local radio and used that to broadcast trivia or math bingo. And other communities at this time are using learning activities during school closures. So students are able to call in and answer questions. In the Kitikmeot, they've also used the local radio to read stories or answer questions about their learning packages and interact with students via telephone.
Okay. Takwili na titsidi kana yapting iluang kakayaw yunot at hatta tuilin na ako titsagun ng naptunik ang kangin ni iglulik miligo takwa no nalin nalaw tikku ngatigo takwa to saksaw tit sa hatta tu aperso hatta sutikiu yaw hatta kun naptunik asing itigo tamak ko ilin na titsiballe hatta tu ilin na bingi matuyaw si matilugit Keter meunit tahu nalau tiku titsihat tap tu tamak ko unika tissilu tik obbalo kiu hatta suti tamak ko wailin na ako tingindot ilang yo halau tiku kiu hatta lo atuti.
So we've also had other schools use social media to interact with students by either posting videos and photos or using it as a tool to communicate with their students. We also continue to navigate the school closures and will develop more creative ways to keeping students engaged in learning. And as this evolves, we evolve with the learning and do our best to ensure that students are learning as best possible through working from home or hopefully in school as we hope to get back to this normal reality of being back in school. Juana.
Takota harisaw yakko solo pihatigi tamako harisaw yakko rotingi solo Facebook kutigo takut saw tit sekata meyo takiya ne ko balo ajingo ane takko to saw matisigo tigi yaw lutilo ilina tit sijingin not taman naila sule akipalle agatigo ilina be khano sana tunikut pinakaron ng mga tatay mailin na palengin nakataron na hulog yakaw nakpakot tay mau te khunak lalo ang lailin na bim mo tay mai no sir khatalaw tatino.
Mathieu Servet, Radio Canada. Since January 31st, the daily rate of absenteeism of teaching staff in 4 schools in Iqaluit has been approximately 27%. How is it justified to maintain schools open at 100% of their capacity in Iqaluit when almost a quarter of the staff can attend the classrooms every day because they're isolating?
Matis Harvey Radio Canada kuni January 31 minute ko pakatang ito ilin natin si Kalon ni 27% mo si Mamatago. Hanoli 100% may matoy magun na takata ko Kalon ni kanayak tikit sa kalo hatilugi ilangi aniteliga hatilugi.
Juana, for that important question about Iqaluit, I'm going to turn it over to Dr. Patterson to give his explanation why, as he's the decision maker. Juana.
So we base the recommendation on capacity at the school, on degree of transmission that's happening or has happened, or I should say risk of transmission in the classroom. If a teacher is out and the class is shut down because they're in isolation outside of for exposure, we're not going to reduce the risk by also reducing the capacity of the entire school. So that's why we don't consider that that isn't necessarily part of the decision.
Tako atuloy ko yaw sa mayo malitugi hatta ko presenting itako no kadyo anak ta hatta tuilin na biyo ni so luilin na titsi hadjang ipatata ko ani teliga harningin no ta ko ilin na bili magalo tay matigi matuyaw gunne matuyaw gayangin mata ko ilin nangi ilin na tin nagin.
So the decision is based on signs of transmission having occurred in the class or in the school, or risk of transmission based on like having a number of students being testing positive with no other link or possible exposure to other students.
Taman na ilay sa maligo tao sa mayohaw isa katam ni ko kanutigi sa mapala sa mayohaw mga ilin na biwilo ani ang balo kanutigi ulo kaya napimigo sa mga tasya maktitsigi katuin ng nasing inuilin na aktiyo yunod kaw isa tao sa mayunod ako no madyan akta sa mayohaw ng inod ug balo ni sila tani kaw yaman ang ituk ko na misa ang mabiwilo ng mga tataman na isumasaksi ko tang katam mayo matuyaw gahang mga ta.
And what would it take, or what criteria would have to be met in order to distribute rapid tests to the schools?
In order to what?
To distribute, to give rapid tests to the schools.
Kiso ni malitaw yung hakayak kata ko akaw yung sa kautit sa yung ilin na binod ato yung nautitaw yung nalikayak kata.
Yeah, thanks, Matisse. And Minister Gross will respond to that on the rapid test, but I just wanted to jump in here and interject a little bit. On behalf of the Department of Health, I just wanted to say a very big thank you to all the dedicated school staff across Nunavut. I know it's been very difficult for the staff in terms of the types of issues that they're navigating, along with the guidance from Dr. Patterson and the department. But I just wanted to state that having schools open in terms of mental health of our young people is very important. And that's why I think we can be proud, looking at the Premier and the Minister of Education, we can be proud that we've put so much effort into keeping schools open. And that mental health piece is very important. Lockdowns and closures are very hard, especially on our young people. And I think if we keep that mental health issue in mind, I think it might help to explain why we're trying so hard to keep schools open for our young people. just wanted to add that context in there as well as extend a thank you to the staff. Taman ihuma lirenya pimario titlugu uko ilinya we ukuinga tin nang ilukap ti ugabu maubluta makuk tubut ihuma migut akor ti daw na kautak mata ilinya we ukwa kematitlugi taman ihuma lirenya okaw heri lagi ako lopaka imaka tukihikan na ko daw yudwa ayak ko mat ho ilinawing ni ukwinga titsiniluk mga apda taman ihuman lagay niyak kanwing itcha ko yinak makutu gayap tinik pidyo daw kataw man o kaw haray lagay pa ka.
One further question, Matisse. So our department right now is working with the COVID-19 Secretariat to ensure that school and childcare facilities staff have access to COVID-19 rapid antigen tests. So the department's plan is to provide these RATs to staff members over a 5-week period. And there are a total of 2,355 staff who will receive the RATs, and this is based on 3 groups. So the first is school staff, which includes full-time and part-time staff, and the 5 substitute teachers per school. The second one is for licensed childcare facilities, and the third one is for the Department of Education staff.
Tako piliri dinga ilin na tuliri ko piliri khate khate te ko no ba jona tuliri na mo alla binganik tako khano ilin na bit pa revelo tako nga khawi sa route ni khila me yo ko te ko nakto ni petita ko nam na mangata tabane pinasa ko siu ni ato ni talle mani 2,253 2,355 kana yakting yan ilin na tuliri ko tako pingasuling ayonik tako nga hawi sa ko tini pitita wala to ikanaya tingit ikanaya nakto tambalo ilani nakwi kanaya hatakto kingo bertingit ato ni talima kingo bertingit ato ni linna bimut ambalo pa revin linna tingit kanaya tingit ambalo ikanaya bingani pili revingani kanaya tingit department ngani okay.
So this means that we'll receive over 35,000 RATs in the coming weeks. And right now we have 15,600 RATs for staff. And the department anticipates to make the first shipments of RATs based on location. So the Kitikmeot being the furthest will see their shipment leave shortly. And then we'll move to the Kivaluk and Kikikdani and Iqaluit. And we anticipate this to happen the first week of March. However, due to isolation of COVID-19, the dates might change, but we are hoping that these can start the beginning of March. I'll let Uli translate and continue.
You're not done. Takwa 35,000 how is it? Takwa 15,000 or 15,600 how is it? Takwa kanaya tinatwid na unalaktot. Sibulak pa maulak titaw lahat yung asinak pa ang makitang miyunot. Aulak titaw niyo sa laktuman nakulog tamalo. Kibalang mo taw talikot. Kikikta ni mo amalo halunot. Takwa pinasa ako siyo sibulak pa nga ni March. Takwa niriugiyaw yung how is it? Asidyak to hangito ako.
So for the final piece in terms of students, right now we're looking into the best practices regarding providing RATs to students, and I can provide an update when we know more information. Juana.
Makinula pa mita ko ilin natit si pidyo tigilugit hanok pila tigit sana pa na himek ko na tagot at we now titaw na akata ilin natit si no tamakwa ko isa ko tigila mi ko tisu. Sorry about that.
Thanks, everyone. That concludes our COVID-19 press conference for today. We'll be back next week on Tuesday, at the same time and same location.
Kaya na may biyak may mata na gadyaw lek yung lang may uti lang may